Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 129,425 confirmed cases of COVID-19 in Canada and 42,421 cases in Ontario. Chatham-Kent has 363 cases and Sarnia-Lambton has reported 339 cases. Michigan now has 103,186 confirmed cases, with 13,679 cases being in Detroit. Today, we are reporting 2,537 cases of COVID-19, an increase of 4 new cases from yesterday. 2 are residents of a retirement home, and 2 are close contacts of confirmed cases. Overall, 26% of our cases are between the ages of 20 and 29 years, and 23% are between the ages of 30 and 39. 65% are male and 35% are female. 2,371 cases are now resolved, and 93 cases are active and being followed by our health unit. 19 people are in the hospital, with 2 people in ICU. Our community has lost 73 people to COVID. 51 deaths have occurred among residents in long-term care and retirement homes. There is 1 retirement home currently experiencing a COVID-19 outbreak. As well, there is an outbreak in 1 facility at a manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you're feeling confused or losing consciousness. Assessment and testing centers include Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Testing will also be available at the Sportsplex at St. Clair College on September 3rd and 4th. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test results. To check your results, please go to wechu.org and click View Your Results to access the online test results portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Today we are reporting an additional death related to COVID-19. A resident of a retirement home positive for COVID-19 passed away yesterday in hospital. She was a female in her 80s, and my sincere condolences go out to her family at this time of grief. Yesterday I spoke regarding public exposure notification. We have issued these via media release over the weekend. However, yesterday afternoon we launched a new page and a process. To review our notification of public exposure, go to www.wechu.org. You will see just below the numbers a link for public exposure notification. Once you click here, it will take you to our public exposure notification page. On this page, we will provide regular updates on possible public exposure to COVID-19. As Teresa informs us every morning, COVID-19 is spread from person to person through respiratory droplets when an infected person coughs or sneezes in close proximity to one another. Public exposure occurs when an individual works or attends a place of business or location that is open to the public while they are infectious for COVID-19, creating a potential for exposure. These exposures will be posted in the table and removed after 14 days. As you can see, the name, address, date of possible exposure, and the date the notification was posted will be posted here. Public exposures will be posted Monday to Friday between 8:30 and 4:30 p.m. and on weekends before noon. Our team will also send out a notification to the media, our social media followers, and email subscribers whenever a new exposure is posted. To keep up to date, please sign up for the alert by subscribing to our mailing list. Our health unit continues to receive questions from parents, teachers, and the school community as they ready themselves for return to school. We have developed a school page on our COVID-19 website. Our comprehensive Safe Return to School toolkit can be found in English and French language. As well, there's a link, school-based guidelines from the ministry, and a link to each school board's current COVID-19 plan. Under the ministry guidance, schools will be required to disclose schools that have a case of COVID-19. Our team is working daily with each of our school boards to answer these questions, create plans, and prepare for a safe return to school. School is a critical component of a child's growth and development. The socialization and structure that school provides is an important aspect of their mental well-being. As parents, we need to ensure that we are talking to our children about what the return to school will look like. There's a lot of news coverage about return to school. It is important that parents take a balanced approach to conversation with their child to reduce their anxieties and fears. Today, I also want to talk about some of the cases that we are investigating in the community and that are linked to some social gatherings and social events. And I would like to use a PowerPoint to walk through some of the description of these cases and to help us better understand what's going on in these cases. Okay. So we talked about what is a contact investigation. So every time we have a new case, our team initiates a contact investigation. It is a systematic process that helps to identify persons that are contact who are exposed to cases of COVID-19. It also helps contacts for possible infection with COVID-19 and provide them with appropriate guidance, whether they need to go for testing or whether they need to self-isolate before their symptoms, or if they're having symptoms, what to do. It also helps to isolate individuals to prevent further spread in the community. It provides an appropriate treatment testing for contacts with COVID. And when we are talking about all these contacts are individuals who have shared living space with a person with infectious COVID-19 disease. So that means these individuals came in contact with a person who may be in their infectious period at that time. This could include household contacts, friends, co-workers, others, for example, cellmates, shelters, residents, bunkhouse residents, long-term care home, retirement home, etc. So any of these places could be a potential place where individuals can come in contact with a COVID case. So what happened with our investigation, when we have a positive case, we initiate our investigation, and then based on that, let's say for example, we have identified 5 cases, and then so 5 close contacts, and among all these 5 close contacts, 4 of them are exhibiting symptoms. And then out of these 4, let's say 3 of them converts into positive cases as assessed by after testing. And then if those close contacts are not identified or contained, then they result in number of other individuals who can potentially contract COVID. So similarly, this is what happens when we talk about what to do in terms of when these individuals are contacted. So when we are doing that investigation, we are obviously are more interested in the high-risk contacts, and then obviously low-risk contacts are advised to ask for self-monitoring of the symptoms. Generally speaking, household contacts are by default becomes high-risk contacts, and that means anyone who lives in the same household while the case was not self-isolating and infectious. If the case was self-isolating during their infectious period, then they may not necessarily be identified as high-risk contacts, but most of the time the households are already exposed to that individual, so is the case. So by default, all of them immediately become household contacts. And then the next part is the community or workplace contacts, where the infectious, where the contact happened either with the infectious body fluid of the case, for example, coughed or sneezed on, or had close less than 2 meters prolonged contact without any mask. So those type of situation happens in large gatherings or in places where more than, when you're meeting with other individuals who are outside of the social bubble. And then you have the low-risk contacts, so those are the household contacts where exposure happened when the case was not self-isolating, and we're also applying consistent and appropriate precautions, that is maintaining physical distancing and wearing the mask or appropriate PPE as needed. Similarly, in the community or workplace settings, they had the prolonged unprotected contacts, but while the case was consistently physically distancing, in a large gathering or in a common work area where physical distancing is always maintained, and the individuals were wearing personal protective equipment such as masks. So those type of workplaces, those type of community events, that's where we are recommending that physical distancing and masks should always be maintained. So even in the situation when you have a positive case, people can be protected. The transient interaction, for example, walking by the case or being briefly in the same room, can also be identified as a low-risk contact. Doesn't necessarily mean that the contact was long enough for the person to contract the disease, but those are the instances where it can happen. So what is happening in more recently, we have seen a cluster of cases in the regions, and I apologize for the last minute slides that we put together. But it started off with a family number one that had an event in August 16, and then the same family. Sorry, I'm having a hard time looking at the slide, so I'll just open up my slides to take a closer look, especially at the dates. But then what happened is they had a party, and then throughout that party, then other cases were identified in that party. Now in this situation, we have more families engaged now. There is a family that got involved that are connected with some of these events that happened, and then we had another family that got involved, and then throughout all of these events, we ended up in having a cluster of case, which is now have passed more than 30 cases in the region. And all of this has started off with people who are not maintaining physical distancing in many of these social gatherings, and then resulting in more spread within the community. And then the next set of people, after they're exposed to that initial event, they went on to the next event, and that potentially exposed other people in that event. And then the same people who attended the next event, they went to the third event, and then that's how it started off in spreading it. So right now it looks much more complicated, but this is the typical scenario. What happens when people are not necessarily following the recommendations of public health, especially when we are talking about the social bubble and the need for indoor gathering, and how it all can potentially lead to a large spread in the community and can potentially put many people at risk. So what happened here, as I just mentioned, so now you have a COVID positive index case, which resulted in 3 close contact of that COVID positive case. And then let's say the close contact A now become a case, and then interacted with other group of people with the close contact D, E, and F, and then they potentially exposed those individuals, and then those individuals went on further. So the close contact E, when that become a case, the close contact E interacted with, let's say, 3 other people, and then infected. The cycle goes on. And in all of these scenarios, if we cannot prevent that spread of disease, or people are not taking responsibility and still engaged in many of these interactions without recognizing that they are at risk of spreading it, either intentionally or unintentionally, when they are in the early symptomatic phase where they may not recognize that they have a symptom and they could be possibly infected with COVID, they can get along with other people and potentially spread it to other people. So the basic idea in all of that is going back to the initial concept of social bubble, that if your social bubble is 10, so that means those are the 10 people that you're interacting with. And even in any of that, within that 10 group, if someone contracts COVID, it doesn't go beyond that 10 people. But in this case, what happens is there are multiple events. One event, maybe it followed, it didn't follow, I don't know. There are some challenges in gathering all that information as well, and then potentially spreading it to other people, and then the next set of people had another next set of close friends or close circle, and then the cycle continued to go on. So as a result, what we have seen right now in the last few days, as of September 1st, that was yesterday, there are 31 active cases, which we are identifying as a confirmed case associated with this new community cluster. So far, all of these cases are active and none of them are passed away. The earliest symptom onset date or specimen collection date is August 20th, 2020, which obviously will mean that the first case will probably get discharged from our care around September 3rd or September 4th, depending on if they continue to remain asymptomatic. And some of the other details, as we can see, that public health is already in contact with 29 of the cases. The 2 cases they were just identified recently, and public health is trying to get to reach out to them for further information. The gender distribution is pretty much similar. What is of notice is the number of individuals between the ages of 10 and 19. So that's the group that is mostly affected by this event, and almost 19 individuals in that age group were infected with COVID-19, and it does definitely it creates more challenges when we're talking about many of the things that we are seeing right now, especially in younger children when their physical distancing is not maintained, and especially when these children will be going to schools in the next couple of weeks. So it is very important for the children and adults mainly, because I cannot imagine that the children are doing all of this on their own without the adults involved. So the adults need to take this responsibility as well, that their children can interact with many other children and have these parties, which could potentially lead to acquisition of disease. And then any of these children, if they are missed and if they are symptomatic, and when the schools open and they go to school, they can potentially infect an entire class, an entire school. So I think it is important that we recognize that this is the time when we have to be more vigilant to keep our community safe, to keep our schools safe, to keep everyone safe. This is what the epidemic curve looks like with the cases that was reported to us. The earliest case, as I mentioned, August 20th with first, but then we continue to see cases throughout the last week with some spikes that we have seen, and we're hoping that with all these outreach that we are doing, we are able to connect with many of the people. So some of the things that what we are recognizing is the stigmatization and discrimination, which is definitely not something that we want to see. We want people to recognize that they have symptoms if they have attended on any of these events. It's that they need to be forthcoming with that information, not from any fear or reprisal from the health unit, but mainly to ensure that we are keeping the community safe. We want those people to come forward. We want to make sure that anyone who is not identified or not named by any of these individuals who attended those events, if they attended those events, if they think that they have any concern, they should connect with the health unit for appropriate instruction. We definitely want to engage the community members through this presentation as well as through the media to make sure that we are not missing anyone out. We don't want anyone who is missed a diagnosis and continue to spread it to other people. We definitely don't want that to happen. There's a lot of misinformation and rumors that's going out there in terms of which party it was, who was it, who wasn't, and I think it's time that we should come together as a community to support each other, to make sure that our purpose is to control the spread of the disease. It's not the time to point fingers, or if not the time to shame anyone or to do anything like that. It's the purpose is to make sure that we do our part, and that anyone who attended or who participated on this event, it's all of our responsibility. And I kept saying that all time and time again. So even if I am invited into a party, I need to be responsible. I need to be careful. Who am I attending with? What my social bubble is? What's the social bubble of other people? And what kind of risk that I'm putting myself into? So it is everyone's responsibility. It's not a single person's responsibility. We should all be working together. So as in summary, some of the key takeaways: high-risk contacts, we know that they need to isolate for 14 days to prevent any further transmission. And throughout the pandemic, we want people to reduce their close contacts by reducing the risk of contracting COVID. private gatherings and parties, it still has a large potential to convert into a very major outbreak if it's not maintained properly. So it is our responsibility that we do that. With large number of individuals that we have found, especially in this cluster, we need to be extra vigilant on all such events to keep our children safe and keep our community safe. So last slide is I just want to ask individuals who attended that event that if you attended any of these events, please self-isolate yourself and go for COVID-19 testing to prevent further spread, and contact the health unit if you have any questions or concern. We definitely don't want symptomatic individuals or a positive case out in the community without identified, because then it can potentially lead to further spread and further spread of the disease. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with Blackburn.
I'm just looking, if you go back to that first slide you had with all the different families. So does it look like all of those exposure alerts are also linked to this one cluster of outbreak?
That is correct, and that's why it took time to piece all this information together. We were collecting all that information and making sure that we can make some of these connections, but clearly, as you identified, that a lot of that is linked, and it's from a true epidemiological perspective, it's comforting to see that these are all linked, because then it explains the pathways, it explains that how someone is contracting the disease. But on the flip side, it also highlights the concerns that how these diseases spread and what people need to do to prevent it from spreading it further.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Do you think we'll see more cases come out of this cluster from these individuals' close contacts that I assume have been contacted and are self-isolating?
Well, that's what we are not sure of. There may be some possibility, and just because of the fact that we heard that there's a lot of social media chatter going on, and which can prevent people from coming forward for a risk of any being identified or being called out on, and we definitely don't want that. We want to make sure that we are connecting with everyone. And if there is someone who either attended that party or has concerns, any questions, they should connect with us, and we want to make sure that appropriate actions are taken. But there is a possibility that there may be additional cases, and we are keeping a close eye on it.
And I know we've had cases for many months now, but is this the first of such defined cluster identification?
That is correct. That would be the first major cluster that we have identified that is connected with so many events, and are easily linked back to some of the exposure notification that went out in the public with respect to the workplaces.
Thank you.
Any questions from Windsor-Essex?
Good morning. I may have missed it, but how many total cases resulted from this cluster?
So far, what we reported is up to 31 cases that we were able to connect with this cluster, and there were some others which are still in the middle of the investigation. We are not entirely sure that these are all connected with this cluster, but as of yesterday, there were 31 active cases that we have linked with this cluster.
And initially, was this party among young people or of a certain age range, for instance?
No, I think at least there were one party that was specifically for younger people, but the rest of the parties were a combination of families and other events that took place.
Okay, thank you.
Any questions from CBC?
Yes, hi Dr. Ahmed. I'm seeing reports that a McDonald's on Dougal Avenue is closed after an employee tested positive, and they last worked on August 23rd. I was just wondering if you can confirm this or if there's any details that you can provide.
Well, sometimes the social media is very quick, and before us or the employer is quick for before we get all those details identified and reported to us. All I can say is we are investigating all the cases that is reported to us, and as needed, if there are a public notification that needs to go out, we will issue that. But in the past, some organizations have taken the step on their own and went out publicly and took some action, which was not necessarily directed by public health, but in the best interest of the community. At this point, I cannot share any potential exposure at this particular business establishment, but we will notify if there is any public exposure, public notification is needed.
That sounds good, thank you.
Any questions from AM 800?
Dr. Ahmed, going back to the community cluster, so family number one, according to your chart, I just want to make sure I have it right. Was someone within family number one had the virus or had symptoms and hosted a party?
They had a party during when they could be infectious, so that's how we felt that that's how it started. But technically, as I said, the symptoms can be mild. The symptoms, the individuals may not even be aware of that they had any symptoms, and sometimes symptoms are mild, and then they continue to, ignore those symptoms. So I think the key message here is what we are trying to say is, even if you have symptoms or if you don't have symptoms, the message is to ensure that who you're interacting with, how you're interacting with, how you're maintaining your social bubble, how you're maintaining your indoor gathering. Because even in the situation when you have a symptomatic person, yes, that's obvious, but if you don't have a symptomatic person, the risk is still there. You cannot say that that event or that particular gathering that you attended was completely risk-free. So I think it's just a matter of taking more precautions when you are socializing, interacting. We understand people want to socialize. We get it. Like it's a no-brainer. But what the message is, how you can do it safely, and I think that's the key message that we want to get out is. I wouldn't worry about whether the person is symptomatic or what they did. That's leave it for the public health investigation piece. But from a public piece, definitely the key piece that we want people to focus on, that how a single party or a single event can result in a large number of cases. So I think that's where we want everyone to understand and take appropriate precaution.
I know yesterday, Teresa and yourself mentioned the 4 establishments that were violating the masking order. And the next step for them would be charges if they don't follow. I guess going back to a party, if an individual hosts a party and does not follow these safety measures, can the individual that's hosting the party be issued a violation order or even charged by the local health unit?
Yes, under the Emergency Management and Civil Protection Act, there are obviously clear definitions of what everything means. The challenge, obviously, despite having this order in place, is the actual event, the information, the evidence, and how you can make those charges. But knowing that yes, there's a possibility. So if something happens and there is clear evidence of violation, then each of these individuals are, I would say, especially even when we are talking about children, but the parents, they can be charged. They, as a family, and the fines can be laid out on them, and anyone who else who is involved and who is not following that. But again, we don't want that, because it would be impossible to police it. I think we need to take some of that responsibility on ourselves, but we do have that option that can be enforced by the law enforcement as well as our public health inspectors.
So is the local health unit looking to charge or send a violation to this family number 1?
At this point, all I can say is the purpose of this investigation or this process is to help explain people what is happening in the community and how they can be impacted. I cannot comment on anything specific about any of the event, but at this point, our focus is ensuring that we are preventing any further spread and transmission in the community.
Thank you.
Any questions from Radio Canada?
Yes. Hi, Dr. Ahmed. We've heard some concerns over the past few days from parents whose children attend French schools in Windsor-Essex. And they say that the information they're getting from the public health unit often just concerns English schools. And I would like to know if the county health unit has any plans to have specific communications to French parents in French, and also based on the particular plans of the two French boards, so Providence and Viamonde.
So I can talk easily about Viamonde, that there are a group of public health unit that are all working together with the I guess the school board, Viamonde school board, and providing that guidance and support at that level, which we are also part of. But for the local French school board, we have had number of number of communications meetings with them. Our toolkit is also is available in French language, I believe, or it's currently it is available in French language, and we have had direct conversation with them. So I cannot say that they're not getting the support that they need. We are always here, and obviously whatever we can provide in French language, we are providing that. But as the expertise, we are not making any difference. We are doing everything that we can to support our community and to support all the school boards without making any differentiation. And our guidance is exactly the same because it's based on public health science, and it's no different for English board or the French board, and we are always here to connect with whoever we need to support in the community.
And just a second question, there's also some concern over the fact that children from the two school boards are going to be using the same buses. Is that a concern? I know there used to be specific measures in terms of people from the same cohorts staying together. Is it a concern to the public health unit, the fact that children from the two school boards are using the same buses?
So our public health message is the same. We definitely don't want to increase the number of contacts. So ideally, if it's possible that however limited number of people that are coming in close contact, that's in the best interest of the public. So I cannot speak specifically that this is happening or this is not happening. I am not aware of it. My team may be, but generally speaking, our recommendation would be to reduce the number of contacts that these children are having. And if it's possible at all, then that's the way to go. But recognizing that there are some operational challenges, which I think the school boards will be in a better position to understand that. Our recommendation would be to reduce the number of contacts everyone is having, even with our kids. If there's a possibility to do that, do it, but recognizing that our recommendations, even for the school buses, talks about the physical distancing piece, talks about the assigned seating and some of the other details that would protect many of these children, and hoping that all of those recommendations are followed.
Thank you.
Any further questions from Blackburn?
No, I'm okay, thanks.
Windsor Star?
No, thank you.
Windsorite?
No, thank you.
CBC?
I'm good, thanks.
AMA 100?
No, thank you.
Radio Canada? Okay, thank you.